Welcome to my channel. Ovulation is essential for conception. Without ovulation, pregnancy is not possible. Normally, if a woman has regular periods, it is assumed that ovulation is taking place. However, in some cases, even though periods occur regularly, conception does not happen despite repeated attempts. So, many people ask me, is it possible to have periods without ovulation? In today's video, we'll discuss this topic in detail, Sha Allah. So let's begin. What is ovulation? First, we need to understand what ovulation means. Women have their menstrual periods every month, but each woman's cycle length varies. For some, it occurs every 28 days, for others every 30, 32, or even 35 days. There are two ovaries on either side of the uterus. These ovaries store eggs, ova, which are necessary for reproduction. According to the menstrual cycle, at a specific time each month, one mature egg is released from the ovary for the purpose of conception. This process of egg release is called ovulation. If intercourse takes place during ovulation, the male sperm meets the released egg, resulting in conception. So, as you can see, without ovulation, pregnancy is not possible. Can periods occur without ovulation? To understand this, we need to know some basic physiology. The menstrual cycle involves several organs and hormones. 1. Hypothalamus and pituitary gland. 2. Hormones. 3. Ovaries. 4. Fallopian tubes. 5. Uterus. The menstrual cycle is mainly controlled by 5 hormones: FSH, follicle-stimulating hormone, LH, luteinizing hormone, estrogen, and progesterone. Let's see how this mechanism works. Our hypothalamus releases a hormone called GnRH, gonadotropin-releasing hormone. This hormone stimulates the pituitary gland to release FSH, follicle-stimulating hormone. FSH helps the ovaries to mature the egg, which is medically called a follicle. That's why it's called FSH. As the follicle grows, it increases the level of estrogen in the blood. When estrogen levels rise significantly, it further stimulates the hypothalamus to secrete more GnRH, which in turn prompts the pituitary gland to release LH, luteinizing hormone. This LH surge causes the mature egg to be released from the ovary, the process known as ovulation. After ovulation, the remaining follicle forms a structure called the corpus luteum, which secretes progesterone. Progesterone prepares the uterus to receive a fertilized egg. While estrogen is initially secreted from the follicle, it also plays a supportive role in pregnancy. If intercourse occurs during ovulation, sperm meets the egg, and conception takes place. But if pregnancy does not occur, estrogen and progesterone levels drop. As a result, the uterine lining, endometrium, dries out and breaks down, exiting through the vagina. This is what we call menstruation, or a period. I hope this explanation makes sense so far. Ovulation and follicle size. Women's ovaries contain many immature eggs. At the beginning of the menstrual cycle, these follicles are about 5 to 7 millimeters in size. After menstruation, they start to grow, and by around 12 to 18 days into the cycle, the follicle size increases to 18 millimeters or more. This size, around 18 millimeters, is considered ideal for ovulation. If the egg is smaller than 18 millimeters, ovulation may not occur properly. Even if an egg is released, it might not be mature enough for fertilization, so conception doesn't happen. However, menstruation still occurs on time. That means it is possible to have periods without ovulation. This happens when the egg is too small or immature, preventing ovulation, but still triggering a menstrual-like bleeding. That's why gynecologists often recommend a TVS, transvaginal sonography, test around the 12th to 14th day of the menstrual cycle, to check the size and growth of the follicle. Causes of absent ovulation. Now, what causes ovulation not to occur? 1. PCOS, polycystic ovary syndrome, 2. Hormonal imbalances, 3. Hyperlactin levels in the body, 4. Infections in the ovaries or uterus. Other causes of infertility. Even if ovulation occurs, pregnancy might not happen for several reasons. 1. Low sperm count or poor sperm quality in the husband. 2. Blocked fallopian tubes in the woman. 3. Hormonal or uterine problems, among others. So, if a couple lives together and has been trying to conceive for more than 6 months without success, they should consult a gynecologist for proper evaluation and treatment. I hope today's video was helpful for you. If you find the video helpful, don't forget to share it with your friends. Please subscribe to the channel to get health advice, health awareness, and reproductive health-related videos. And remember to become a member of our family. Stay with us healthy and safely. Thank you for watching this video.